You ever notice how some medication names sound, well, pretty much the same? That is absolutely not an accident. Today, we're going to crack the code on a whole class of drugs that are all hiding behind one simple little suffix. Let's dive right in.
All right, let's kick things off with a little puzzle. Take a look at these three common medications. What do they all have in common? So first up, we've got amlodipine, which you might know as Norvasc. Then there's nifedipine, also called Procardia. And finally, felodipine. Listen to those endings really closely. Amlodipine, nifedipine, felodipine. Are you hearing that pattern? Yep, if you spotted that pine suffix, you absolutely nailed it. That little ending, that's our golden rule. It's an amazing shortcut that tells you that you're dealing with a very specific class of drugs. Now, the official name is a total mouthful, dihydropyridine calcium channel blockers, so, we're just going to call them the pine drugs for now. Much easier, right?
So here it is, the big takeaway. If a drug ends in pine, your brain should immediately think potent vasodilation. That's just a fancy way of saying it widens blood vessels. And this effect is incredible for treating high blood pressure, that's hypertension, and chest pain or angina. If you remember only one thing today, make it that connection.
But how do they actually do that? I mean, it's one thing to know the rule, but it's way cooler to understand the elegant science behind it. So let's take a peek under the hood at the mechanism of action.
Believe it or not, it all comes down to this really simple four-step process. First, these drugs block something called L-type calcium channels. Just think of these as tiny little gates on the walls of your blood vessels. By blocking them, they specifically target the smooth muscle in those vessels. This makes the muscle just relax, which leads directly to step 3, potent vasodilation. And, of course, when your blood vessels get wider, your blood pressure naturally goes down. See? Simple chain of events.
And just so we're crystal clear, vasodilation simply means the widening of blood vessels. Think of it like swapping a narrow garden hose for a big fire hose. The pressure inside just naturally drops. This one single effect is the absolute key to everything these pine drugs accomplish. So now that we get how they work, it makes perfect sense why they're used, right? The clinical applications just fall right into place. Let's see how this all connects in the real world. Because of that powerful vasodilating effect, these drugs are a first-line treatment for hypertension. They're also a go-to for angina, because widening those vessels improves blood flow straight to the heart. And here's a cool one, they're even used off-label for Raynaud's phenomenon, which is a condition where blood flow to your fingers and toes is restricted, which, again, makes total sense, knowing what we know now. But you know how it goes, there's always an exception that proves the rule, isn't there? While most calming drugs focus on the heart and your general circulation, one of them stands out, nimodipine. This drug is special. It's used to prevent spasms in the brain's blood vessels after a specific type of brain bleed. A very different job for sure, but still, it's all about relaxing blood vessels. Of course, no drug comes without a catch. But the real beauty of understanding these pine drugs is that even their side effects make perfect, logical sense. They aren't random, they're directly linked to the very thing the drug is designed to do. This is the key. The side effects are a direct consequence of that powerful vasodilation. You could almost say the drug is too good at its job, and that same widening action is exactly what causes the unwanted effects. Just think it through. When blood vessels in your head widen a bit too much, you can get a headache. Widespread vessel dilation can cause you to feel flushed and maybe a little dizzy. And the most common one? Peripheral edema, or swelling in the ankles. That happens because the tiny vessels can get a bit leaky when they're so relaxed. It all connects right back to vasodilation. All right, let's boil all of this down. If you walk away with just one single piece of information today, make it this. This is your final, most important takeaway. Let's bring it full circle. If it ends in pine, it's almost always a dihydropyridine calcium channel blocker that causes vasodilation and is used to treat hypertension and angina. Just memorize that sentence and you've cracked the code. Once you see a pattern like this, you'll start noticing them everywhere. The world of medicine is full of these hidden codes. So my question for you is, now that you know this rule, what other drug family names can you spot? Keep your eyes open, you'll be really surprised what you find.